Hi, this is Miss James. I'm going to go over with you newborn growth and development so we can maximize our time in class. We are only going to be covering newborn only. Further than that, after a month of age, that is pediatrics. So anything that you find in this lecture in the PowerPoint that's relative to an infant, you aren't going to be responsible for that in this class. It'll be pediatrics, but do understand there's overlap, and so we won't. Sometimes it's just a little more difficult to separate it all out when there is overlap. Growth and development of the newborn period is from birth until about 28 days of age, and that's how far I will expect you to study as far as an exam would go. Those of you who have been in OB or even in pediatrics, you know how important measuring height, weight, head circumference, chest circumference, all of that is very important, and it's important that we have a good baseline to start with so that we know if the baby is growing appropriately or if they're failure to thrive or if they have some other problem that is causing them to not grow appropriately or if they're growing too fast. There's a good table, page 886, of the average measurements of the infants at birth. And these are just averages because we know some babies are born that they weigh more than 7.5 pounds or they're longer than 21 inches long. But this is a good average so that you'll have something that you can go by. We normally weigh babies in grams. We use pounds and ounces because parents have something that they can relate to, but for medication dosing and for other types of things that we want to make sure we're in a normal measuring realm, we want to measure in grams. For their head, for chest, for height, length, we measure in centimeters. We give it to parents in inches because they can relate to that, and for documentation purposes, we always document in centimeters. Here again, this is the same thing that you'll see on page 886, just some more information for you. The 6 stages of consciousness, this you will find on page 887 of your book. You need to know what the differences are so that you can help the moms and dads understand what's going on when the baby's deep sleeping and what's going on when they're just drowsy. That way they can tell if there's something going on, and because these are the cycles that the baby goes through. And they go through these states of consciousness so we can reassure the parents that it is normal as long as it is normal. And if there's something abnormal, we should be able to figure that out. You need to know what the different reflexes are at birth. And these are on page 888, 889, 890, and 891. The reflexes on 892, those are for older infants. So we won't be responsible for those. Those are more related to pediatrics, but you need to know what these different reflexes are. And they're again protective reflexes, so that's more for the pediatric age baby. Sorry, we're not finished. Urinary system, they should be having frequent urination. They should be taking in enough to have enough diapers a day. That I'm trying to think of a good way to explain this to you. They urinate more frequently because the urine has a lower specific gravity because the renal system is still maturing. The glomerular filtration rate is still immature. Renal perfusion is immature. They don't reach full maturity until the age of 2, so they should be urinating frequently. If they aren't, then there may be a renal problem that we need to talk to the physician about. They have normal skin variations. Their skin is very thin in comparison to an adult. Of course, we know when they're born, their skin is usually covered with vernix that protects the skin from the amniotic fluid. They may have burnix in the folds of their skin, the axillary area, their groin. Um, they also may have fine hair that's called lanugo over their body. And usually this hair will be lost over time and it's not replaced. Darker skin babies tend to have more lanugo at birth than those who are lighter skin. We've already talked about acrocyanosis before. If you look at the picture on 25.3, you'll see a picture of acrocyanosis where the hands are blue and the skin is mottled. They'll also have mottling, pink and white marbled appearance because their circulatory system is immature. That skin is really, really thin, so we can bruise it really, really easy because capillaries are very close to the surface. And so any type of topical medications, they will absorb them quite easily. So we have to be careful if we have anything on our hands that's not for the baby. Physiologic anemia is a hemopoietic system that we will expect. It's due to the loss of hemoglobin F. The iron stores are depleted if they aren't supplemented. This usually occurs in the first year of life. At birth, the hemoglobin F is present in large amounts, and after birth, the fetal hemoglobin will essentially just stop. So we have to pay close attention to make sure that we don't have a baby that's developing physiological anemia. Immune system is also very immature. They receive a lot of IgG from mom and through the placenta, and then this will help take care of their immunity for the first 3 to 6 months if mom's good and healthy, and then they can start synthesizing their own. Psychosocial development, you guys have learned this before, is Erickson trust versus mistrust is very important for bonding during this time. It's very important even if they're a NICU baby that mom and dad are allowed to be in and touch and hold as much as possible. Jean Piaget's first stage of development cognitively is the sensory motor stage. This starts at birth. This is when they begin to learn cause and effect, object permanence, discovering of self, and of course a lot of this is not even relative to a newborn, but it begins at this time. Gross motor skills is a cephalocaudal progression. You need to know what that means. From head to tail. This is when they start with head control first and then rolling, sitting to walking. Fine motor skills start with the finger grasp and the pincher grasp. And very little tiny indications of this whenever they're at the newborn age. This starts progressing more as they mature. The newborn's hand movements are very involuntary, and then the older they get, the more they'll start developing the fine motor skills. If you'll look on table 25.4 in your book, you'll see what they're able to start doing by 1 month of age. Erickson and Piaget on table 25.3 on page 896, if you just kind of familiarize yourself with that first stage of Piaget. Reflex sucking and ingesting nutrition. That's about as far as newborn will go related to that developmental theory. Sensory development, their sight, they prefer faces. They're very nearsighted. So they prefer to view objects at a distance of no more than 8 to 15 inches. They rather see your face instead of other objects. They might even imitate your facial expressions for those that are caring for them really close. Hearing is as acute as an adult when they're born. They can recognize common sounds. The smell and taste is very rapidly developing. They can differentiate tastes that they don't like by 7 days. They rather have things that are sweet, although we know we shouldn't be giving them sugar water. Uh, but you can tell, especially those if you're having to give them iron, how much they absolutely dislike it, even though they're newborn. Touch is the most important sense for the newborn communicating. They like soft touch, and they can interpret your mood by touch. They can tell if mama is anxious or upset by touch. It's the most important of all newborn uh, communication through their development. Even the most immature infant will respond to a soothing, stroking uh, touch by mom or another caregiver. They rather something soft. They don't like to be handled roughly, and they will cry. So think about some of those experiences you've watched in the nursery of rough handling of the infants. Holding, stroking, rocking, cuddling, swaddling. Whenever they're upset, those are very important. And they'll start to learn what the caregiver's mood is just by the touch and how they're handled. All right. Communication and language. We know that whenever they're born, they cry, they coo, they make different vocalizations. But when they're newborn, they're either quiet or they're crying whenever they first come home. But mom will start learning and dad will start learning what their different cues are. And sometimes they have different responses to different voices. Now, this responding to their own name, those things won't happen until after they get older. And the babbling, that usually starts about 7 to 10 months, mama, daddy, around 9 to 12 months. So these types of things we're not expecting whenever they go home as a newborn. Um, but we should be watching for a normal progression with their hearing and a normal progression of how they choose to communicate with us. They're smiling to let us know things are okay. They're different cries for when they're hungry, when they're upset, or when they're hurting. We will start learning what their different communication skills are. They're ready to socialize by the time they're 2 months old. Whenever they come home newborn, they're not really that interested. They're interested in eating and sleeping, which is important for their development. And so these other concepts here and information is just for your own information because these things happen later and not at the newborn stage. Culturally, we always need to be cognizant of the culture because some cultures are different as far as feeding practices, um, when independence should start, what the primary caregiver's role is, and different decisions in the care of the infant. They have different health beliefs, and there is a huge controversial cultural, very significant cultural consideration in the co-bedding. It's happened more and more where infant is in the bed with parents or in the bed with other siblings. Someone roll over on the infant and suffocates the infant. But there are some cultures where this is acceptable. It is our job to point out the dangers of it and document it very clearly if parents still choose to co-bed the infants because it is, while it is dangerous, we still support what the cultural beliefs are. Um, so certain cultures place a high value on independence, and they may want their infants to develop early, and you must be aware of that. In some cultures, mom has the primary responsibility for caring for all of the children, and dad really is not an active participant. So It's very important for us to be aware of all of the cultural beliefs and health beliefs of the clients that we're taking care of so that we don't offend them if we're expecting them to do something the way we do it in our culture. Anticipatory guidance is just a way for us to anticipate what is needed to promote healthy growth and development. Screenings and immunizations are important to support adequate growth and nutrition. We want to make sure we promote early parent and infant bonding as much as we can so that there's not a role strain with only one caregiver taking over as long as it's possible. Sometimes there's role strain because the other caregiver is in the military or works away. So we need to pay close attention to that and anticipate some things that we may need to help mom about. Play and early learning, that is for later. Safety is very important for us to talk to parents about, making sure they have the right kind of crib, making sure they have the right kind of car seat. We do not set up car seats in the car for the parents. That is for them to do. We can hook it up and show them how to do it, unhook it, and have them do it again because it is their responsibility. Their baby is their responsibility, and you will be held liable if you're the one that hooked up the car seat. There's an accident and that baby was injured. Water safety is another very important thing to talk to them about because the baby can drown in the smallest amount of water whenever the baby is being bathed or around any water. It's very important that you never take your hands off of that baby or turn your back even for a second. They will want to put things in their mouth very early on. It's very important to make sure to keep all of those things away and make sure that if there are other siblings in the house that have small toys, that we talk to the parents about that because they will start putting things in their mouth very early on. Children can suffocate with big blankets, with big bumper pads, with big pillows. It's very important to move all of those things. If you don't really need bumper pads, they do make a type of screen now that can go around to keep the baby from hitting the slats of the bed. But those bumper pads, children can get up against those and suffocate. Gotta have a rear-facing car seat up until they're a year old. Never, never, never leaves the babies unattended, and you need to really, really caution them about that. Appropriate toys, you can see those on page 908 in your book. For newborn, if they just have a mobile with a contrast of color and patterns hanging above their bed, that's perfectly all they're going to need. You don't need to throw a bunch of stuffed animals in the bed with them. That is not safe either. Home safety, like we said, a really good crib that's safe, that have the slats that are appropriate. On page 908, it talks about crib safety and how the crib edges should be and where it should be located. Water safety, we've already talked about that again. Toilets, buckets of water, swimming pools in the backyard. So many accidents have happened with water, and it's very important to be cognizant of that. Promoting good nutrition, here again is that word culture. Some dietary practices are affected by culture and the types of food and how we approach the feeding progression. As we know, newborns are not to have any type of solid foods or any kind of rice cereal or anything like that until we're sure that they do not have any type of food allergies. Some ethnic groups, especially Black or Native Americans or Asians, are lactose intolerant, and so we have to find alternative sources of calcium for them. Sometimes that might be why you have a colicky baby, is because of a lactose intolerant. So we need to know what the cultural practices are so that we can help them find what's important to promote nutrition for these developing babies. You can read the slide. Fluid needs are 140, 160 mils per kilogram a day. Um, Calories 105 to 108 kilocalories per kilogram per day. Breastfeeding is recommended, of course, it's natural and it's preferred. Um, but the exceptions are if the baby's got galactosemia, if mom is a drug user, if she has TB, or if she has HIV. Those are the times that breastfeeding is not recommended. Bottle feeding, um, standard is 20 kilocalories per ounce is recommended for the first year. They are not to be drinking cow's milk. It is inadequate. It is not nutritionally sound. The baby should always be held to be fed, no bottle propping. Feed the baby when they're hungry, usually 6 to 10 times a day. As the stomach size increases is how much we'll feed the baby. And the volume will increase. And then when the volume that they take in increases, then we'll feed them less often. You can read all about breastfeeding on page 910. I'm not going to take time to read all about that today, but you can read it on what's important. On the box 25.1 on page 912, it gives you some very good important facts to teach mom about preparation and storage of bottles with formula. It's not necessary after the baby is no longer a newborn to boil everything, but they do have to be washed in hot soapy water or run through the dishwasher so that everything is good and washed and clean for the formula, or for breast milk too, for that matter. On box 25.2 gives a good list of foods that cannot be given to an infant because of food allergies, and that's important for parents. It's on page 913. Sometimes infants do develop allergies to their formula, and they have to change to some type of formula that meets their needs, especially if they're real colicky and we just cannot seem to start causing them to have diarrhea or rashes. We may have to put them on a special formula. No solids until after 6 months. We have to make sure that they're ready, that they can swallow. And then we can advance the texture. No cups until they're 6 to 8 months old. And sometimes some babies just mature quicker, but we have to make sure that they're able to handle the swallowing. Healthy sleep and rest is very, very important. All of this is on page 913 of your book. Newborns sleep a lot, and it's important. You'll hear a lot of moms say, oh, they slept through the night. They really need to check with a healthcare provider for this, because really and truly, every 3 to 4 hours, those babies should be eating. And sometimes, even though they are sleeping, you need to wake them up because they need to eat. They're burning calories even when they're sleeping. Strict schedule, no, but at least every 3 to 4 hours. Newborns usually sleep about 20 hours a day, and they wake to eat, and then they'll go right back to sleep. And oh man, yep, it does make you feel good that they're sleeping all night long, but they need to wake up and eat. Safe sleep, back to sleep is very important. Healthy People 2020 on page 914 talks about needing to encourage and teach about safe sleeping practices. It's important for mamas to rest when the babies rest, because if you don't, you get really worn out really quick. A routine is good, but it does not have to be really, really strict. Some moms think we've got to eat by this time, got to do by that time, but it just makes you and that baby very anxious and nervous. Babies will learn to soothe themselves. That means you don't go pick up every time they're just whimpering because they do need to soothe themselves. Otherwise, you're going to be picking them up constantly and they won't know how to comfort themselves whenever there's not really anything wrong. Usually by 4 months old, they don't need to eat at night anymore. But there again, that depends on the child and depends on what's going on. Teeth and gums, that's usually later in life. It's not during the newborn time. Newborns, though, after feedings, you do need to clean their mouths with a damp washcloth so they won't start developing some nasty stuff in their mouth. First dental visit should be by age year. It's very important. Um, you can read about colic and the causes of it on page 915. Those of you who have had colicky babies know what happens. They are just inconsolable. Sometimes they'll cry for as long as 3 hours. It makes you crazy. Um, Usually when they're about 3 months old. But if you're breastfeeding mom and you're trying to be really good and healthy and you're drinking a lot of milk, eating a lot of gas producing foods like broccoli, cauliflower, I will tell you now, you'll probably give the baby a lactose intolerance or give them some good cases of gas because what you're taking in, they're getting in the breast milk. That's what I did to mine. I didn't know better, didn't know that I drank a lot of milk. It would cause a kid to be lactose intolerant, and that's exactly what happened. The way to take care of spit ups is by not feeding the baby quite so much. I know we bring babies from the nursery to the mom, say this baby needs to eat 30 meals every 4 hours. Well, you do good to get 20 down. And that's okay because if the baby's not taking any more, all that's going to happen is you causing them to spit up. That baby doesn't need to lay back down after taking a bottle. It needs to be sitting up in its little seat or held upright for about 30 minutes so they have a chance for the food to go down and digest. But there are some babies who have a little bit of reflux. Grandmas love to bounce those babies up and down. That's not good right after feeding because you're going to get spit up right back. Should be wetting at least 6 diapers a day. That's a good number. As long as they're gaining weight too, wetting at least 6, gaining weight, spitting up a little, but not a whole lot. If they keep on spitting a lot and it's more like vomiting, we need to tell the healthcare provider. Discipline is not really a whole lot you can do about discipline whenever they're newborns. This is more for pediatrics. We do need to childproof the home, but there again, this is for pediatrics. What kind of child care are we going to have for our new babies? Are we going to have a sitter or are we going to get to be stay at home and take care of our babies? What's going to be the best for us and best for the baby? Are we going to have someone come in the home or are we going to take the baby to daycare? A lot of things to consider. How much does it cost? When we're thinking about daycare, are they licensed? Do they know CPR? What do you know people that have had their children there? You got to do your homework. I used to say people will leave their children anywhere whenever you see how some daycares are. So a lot of things to think about and expect separation anxiety. Even if they're an infant, they will know that you're leaving them. We talked about colic and spitting up already. Good ways to counter spit up is burp them often. We'll just talk a little bit about thumb sucking and pacifiers. Pacifiers, if you talk to a lactation consultant, may cause nipple confusion if you introduce one early. After you get breastfeeding established, usually it'll be okay, because sometimes that's a self-comfort for the baby if you have one that likes to really suck a lot. It has been shown to help um, prevent otitis media, but it's very important. These things must be kept clean. Um, Not necessarily boiling, but you can throw them through the dishwasher just like you do the nipples for the bottles. Um, don't try to take pacifiers away if they're really stressed. Usually by a year they need to go away because they will affect the teeth development. Um, Teething you're not going to see in a newborn. So I'm not going to talk about that. That's more for pediatrics. And this is all that I would expect you to know for newborn growth and development. Um, there's a good digest of everything we've talked about on page 917. There's also a good writing about pacifier use on page 916 that may be very helpful to some of you. If you have any questions, please let me know.